So in today's lecture, we will classify principles of microbiology and especially the bacteria which is quite difficult is gram-negative family. So when we discuss about gram negative bacteria, they give on gram staining a pink colony. So pink colony, there are four categories on the basis of their morphology. First one is Diplococcus. The Diplococcus one, they have two round cocci, and in this category we have meningitis. First of all, we tell they are aerobic and they are on Maltese testing. They are Maltese positive and Maltese negative. When we did Maltese positive test, we find Neisseria family of meningitis, and on Maltese negative, a special one, Moraxella, which is quite low yield, but when we get it on our test, then this low yield get into a tricky one question, and it will give a relative high marks point on USMLE. And then obviously the negative one is gonorrhea. Next family is Coco bacilli. It's a combined form of in somewhat intermediate between a cocci and a bacilli. So in this family we have Haemophilus influenza, very important, very high yield. Then Bordetella pertussis, and then we have the low yield bacteria, in which we have Pasteurella, Brucella, then Francisella, Tularensis, and Acinetobacter. Then we have another family of curved bacteria in curved rods like this. So there we have first one is which grow on 42 degrees centigrade is Campylobacter jejuni, very much important in sending paralysis. Guillain-Barré. Then we have on alkaline or thiosulfate or citrate bile salt agar growth, having Vibrio cholera, which gives voluminous watery diarrhea, cholera. And then we have urea producing or urease enzyme bacteria, which is known as we all favorite Helicobacter pylori. Next one we have is then we have the bacilli. These are rods, gram-negative rods. In bacilli, our first test is McConkey agar or lactose fermenters. First one is lactose fermenters are the Sikh ones, in which we have Citrobacter, slow lactose fermenter. Then we have Enterobacter, which is fast fermenters. then E. coli, fast, then Klebsiella, which is also fast. Then we have Serratia, which is slow metabolizer. So these all are lactose positive. Then we have lactose negative, and in this category we have the first classification based on the oxidase positive test. So oxidase positive one are the Pseudomonas aeruginosa, and the new one is Burkholderia specia, which is a modern in cystic fibrosis, immunocompromised, immunodeficient patients. We have this bacteria. Then on the oxidase negative test, we have another test which is hydrogen sulfide gas producers on TSI agar. The gas producers are Proteus, nosocomial infectious bacteria, and the Klebsiella. And on the negative gas producers are Yersinia pestis and Proteus, Salmonella. And Yersinia and Shigella. So this is a brief description on classification of gram-negative bacilli. Next we will discuss the algorithm of gram-positive bacteria.